I don't know if the situation is for many of you, but in the New York area, there's a high incidence of patients making a first appointment and then not showing up. And that's extremely frustrating. And why is it that patients will not show up on a first visit? It's usually because they really don't have a relationship with the practice, or certainly with the doctor. And when they have this relationship, they are more likely to feel compelled to come in and complete or at least continue the relationship. So what I like to do is the night before a patient's first visit, I will call them, usually in my car on the way home, and I'll say, "Hi, Mrs. Jones, this is Dr. Katz." I always like to call guests before they come to our practice for the first time to welcome them and to introduce myself. And I'd like to know before you come in, are there any particular concerns that you have so that I can be even better prepared for your arrival? And the reaction is usually, "Wow, I've never gotten a phone call like that." And we'll engage in some conversation. They usually don't ask anything about concerns. They thank me for the phone call, and then they have a much better incidence of showing up. Even when they're not answering the phone, this is exactly the message that I will leave on their answering machines and their voicemails. When they come to our office, they say that they've never received a phone call like that. And it is the beginning of a relationship. And it is through these relationships that we start to develop believability, likability, and trust with our patients so that they become more motivated and more inspired, that will allow them to accept much more comprehensive treatment plans. Oh, sorry. No. There are 4 ways to grow your practice. You can increase your number of new patients, you can increase your capacity to do more dentistry, you can increase your number of high profit procedures, and extremely important, increase your acceptance rate. Now, wouldn't it be great if we all had the leverage of Marlon Brando in The Godfather?
I'm going to make him an offer he can't refuse.
Unfortunately, we can't exhibit this type of force with our patients. But there are things that we can do to develop the relationship, to connect with them on an emotional level, to make them understand that we understand them, and that there's a greater partnership and teamwork between them and us in helping them come to the solutions and the desires and the beliefs and the dreams that they have when they come to our offices in the first place. See, case acceptance goes way up when you and your team connect with the patient on an emotional level. Stop trying to teach patients dentistry, because people make decisions about their dental treatment based on emotion, not on education.
Oh, sorry. You know, I don't mean to embarrass you, but I'm a rather brilliant surgeon. Perhaps I could help you with that hump.
What hump?
When Dr. Frankenstein made that suggestion to Marty Feldman, unfortunately, he was doing something that we see among a lot of dentists. We're trying to treat humps. We're trying to treat things that the patients do not have concern over or that they don't have an awareness of. And it's important for us to try to trigger the awareness and the concern that they have by tapping into a much more emotional connection with the patients. See, in dental school and in hygiene school, we're taught to be aware of the patient's chief complaint. And what is the complaint? It's usually a condition: a chipped tooth, a fractured tooth, decay, a toothache. Are our patients really concerned about these conditions? I will tell you that they really are not, that they really couldn't care less. But what they are concerned with is, how do those conditions affect their lives? You see, we have restaurants in the New York area that on Thursday nights are singles nights, and men and women go there to try to meet friends, acquaintances, and maybe relationships. And when a woman is there and she's talking to a gentleman and he's staring at her teeth because she has discolored resins or maybe a diastema or some rotated teeth, how do you think that makes her feel? And when you have somebody who has a toothache and they find that it's distracting to them at work, they can't concentrate, and then they go home to try to help their child with their math homework, and their temper's a little bit shorter, and they end up getting into a battle with their child over homework because their tolerance is not that great. Or a gentleman who's retired and he's trying to play tennis with his friend, and every time he runs around the court, his denture is flopping around in his mouth, and he can't enjoy lunch with his friend. You see, these are the effects of the conditions. These are the emotional triggers. These are the true reasons why our patients are coming to us for care. Not to take care of the conditions, but to take care of the effects of the conditions. So our treatment then has to be geared towards solving the effects. The solution has to be for the emotional disability that's caused by the condition. So when we talk to a patient about restoring a tooth that's broken, what we're talking to them about is alleviating the potential that they could have a situation that interferes with their ability to work. And when we talk about something cosmetic, we're talking about the ability to raise somebody's self-esteem, to improve their ability to function in a social environment, to make them more successful as they're looking for jobs or in social situations. You know, when we talk to a woman who tells us that she's embarrassed because her grandson made fun of a missing tooth or some dark teeth, this is a real emotional trigger for her. And so if we can tap into that emotion and tell her, well, why don't we go to the treatment room now and not fix your teeth, but let's restore your self-esteem. And let's make it so that you can smile for your grandchildren and not feel embarrassed. Those are real intense emotional motivators for patients wanting to proceed with treatment. It's very important that we establish a relationship that shows that we're understanding. And a very valuable tool, it's been very powerful with some of the practices that we work with, is something that we call the permission statement. And here's the permission statement. When I finish my initial consultation with a patient on their first visit, and we're having our little chat, before we ever go to the treatment room, and sometimes I may use this when we've completed some of our treatment presentation, I will say, Mrs. Jones, as you can see in our practice, we are very relationship oriented. As part of that relationship, I want to ask your permission that I can be honest and truthful with what I'm telling you about the condition of your mouth and how I might recommend taking care of some of the situations that we see. However, I want to make sure that I give you permission to make all the decisions. You see, it's your mouth, Mrs. Jones, and I understand that there are situations going on in your life that may impact on what decisions you make. And I want you to understand that I respect that as well. And together, we're going to be team and we're going to be partners in this journey we take to solving some of the things that you discussed with me about being embarrassed and being ashamed. How does that sound, Mrs. Jones? And you should see the change in posture of a patient who now can relate to you in a much different way than they have ever related to with another professional. It is really a feeling of togetherness, of a feeling that they have found the right place, and that the level of care they are going to receive under your supervision and your guidance is going to be much different than what they've ever achieved before.